All right, so this is all about blood gases, part one. All right, part one of blood gases. Oh, wait. Absolutely, absolutely. It just said I need to install a driver, and when I tried to do it, it said didn't have permission or it wouldn't let me.
You're moving this, so that's
Okay.
probably what it is, but I'll take it.
Okay, I appreciate it, Nikki. Thank you. All right, so we'll talk everything there is to know about blood gases once we get through all the parts. This is just part one, which I'm going to say is extremely basic. I don't get all to the complicated parts of it today. I saved that for next week and even the week after. So this is just the very basic fundamental parts. Hopefully you walk out of here today going, okay, I got it. I can interpret a blood gas, and that's great. That's what I want you to walk out of here today with, so then I can throw the curveball at you guys next week and go, oh, okay, that's what can make it so challenging.
Is it going to end up being a fastball and break our jaw?
Not that fast.
I said, how about no?
Okay, how about no?
How about no?
You didn't get no options. No options here. So before I get into the interpretation, I forgot I did add this first part, kind of the schedule for the rest of the semester in this class. So I was supposed to wrap up chapter 11 today, but I already did that on Monday. So I just slid my first part of ABG interpretation here Wednesday. We'll do some more next week as well as the week after before we test. So if you remember, chapter 9, that was about the brain. No, was that the brain or was that was CO2? Sorry, that was CO2 transport. 11 was about the brain, and then everything else is going to be about what we're starting today: blood gases and blood gas interpretation. Then we have ventilation perfusion. There's your VQ ratios, functional anatomy. We'll break for again Thanksgiving. God bless you, and then final exam review and final exam. Again, this final exam, fundamentals final exam, does occur on the same day. That's RD Day, December the 3rd.
So our last day of ABGs
Is the 10th. Is the 10th. So I purposely already dedicated 3 days to ABG interpretation. I'm still going to hold true with that. Really need 3 days to cover this. That means we actually have 4 days worth of 3 days to discuss. So we'll see how we go through, how things are progressing with that. I am not changing the test date. The test date still will be November the 12th. So that's not gonna change. If anything, it gives us an extra day to go over and make sure we're totally 100% confident and competent on ABG interpretation. All right. So, what do you know? Here's the slides I didn't give you. Wink, wink, hint, hint. All right. What's a normal blood pH? Don't blurt it out. Let me read it. Is it 715 to 725? Damn it, where's those normals? 720, 730, 735, 745, 740, 750, or 755, 765. What's a normal blood pH?
C.
That is C, 7.35 to 7.45. You have to know that. If you're going to interpret, you have to start with what's normal first. What about arterial CO2? 22 to 26, 30 to 40, 35 to 45, 80 to 100, or 50 to 60? C, 35 to 45. Boy, that 35, 45 number combination. Thank goodness for small favors, right? That easy to remember, easy to associate. So pH 7.35 to 7.45 is normal. CO2 normals, 35 to 45 is normal CO2. What about arterial PO2? 95 to 100, 150 to 250, 35 to 45, 80 to 100, or 50 to 60. Normal arterial O2? D, 80 to 100, 80 to 100. Sometimes, and I've had people do this before, I'm not saying it's going to be you, I've had people sit there and tell me this was the right answer, but they confuse oxygen saturation percent with PO2. And oxygen saturation is a percentage, not a millimeter of mercury. So be careful not to get those flip-flopped or backwards. What's a normal blood bicarbonate? 22 to 26, 30 to 40, 35 to 45, 80 to 100, 50 to 60. This one is A, 22 to 26. And so when we do take the exam, when we do take the test, or I ask you to interpret, I would always say, jot down the normals first, That way they're there, that way they're in front of you. So I've had people take the test and they're 10 ABG interpretation questions in going, oh my God, my head's starting to spin. I'm starting to get the numbers. Write the normals. That way they're always there. And then you could always then look at each individual ABG until the normals become so plastered on your brain, you can't not ever remember them, because you will. They will be implanted on your brain where you, at a certain point, you won't have to jot down normals because they're just always going to be there. You're never going to forget. All right, so there kind of probably starts the slideshow that I've posted there. And again, I left some blanks. So make sure you can fill in the blanks as far as what is normal. What is normal? I'll leave it there for a few seconds. If you wanted to snap that picture, if you have the slides in front of you and you wanted to jot down in your device, by all means, please have at it. But you have to start with what's normal first. You can never interpret if you don't know what the normal is in the beginning. As we go through these blood gases, these next 3 or 4 days worth of blood gas interpretation, and I said this the other day, everybody picks this up at a little bit different pace. Some are going to be quicker than others, and that's okay. That's why I spend so much time and dedicate so many days to make sure we talk about blood gas interpretation, because it's extremely important to be able to interpret an ABG. Nobody's going to be there at the bedside to tell you what it is. You have to be able to interpret. And the same thing's true when we get to our board exam questions and they give us blood gases. We have to be able to interpret, because once we can interpret, then we can figure out what the problem is, and then next, what we need to do to fix it. All right, yes?
Can you please remind me what the unit for the determinant is?
Okay, thank you for that. pH is pH. There's really no units associated with this. The CO2 and the PO2 is millimeters of mercury. Sometimes, and it's the same number, it's just different name for the units. Sometimes they'll call it torr, T-O-R-R, to not be confused. So if you see torr or millimeters of mercury, it's the same thing. It's the same thing. This MEQ/L stands for milliequivalents per liter. Sometimes you can even see millimoles, MMOL/liter, meaning the same thing. But milliequivalents, millimeters of mercury, is probably what you're going to see on the NBRC exam. So that's why I kind of stick with those particular units.
On your previous slide from this one, you put millimeters of mercury. Was that a typo, or can it also
For which one?
be this one?
That one.
Yeah, you didn't see that, did you? You didn't see that. Because thank you for calling me out on that. I appreciate it. Yes, that should be milliequivalents per liter. My apologies. You know how many years I've been doing this slideshow and nobody's ever brought that to my attention? I didn't even print out these slides. It's bad habit, I guess. All right, thank you for bringing that up. All right, when you ultimately get a blood gas to look at or to interpret, it may be something like this. This is what you may see. This is what could appear on the machine that you actually enter the blood gas sample into. And these are the results you're going to get. Now, I say this, for me, is not an instructor-friendly example, because it drives me crazy that the system has to label things as abnormal, high versus low. I don't need the system to tell me what's high or what's low, because we should know what the blood gas is. But some systems do, like what you're seeing here. So for example, what's a normal arterial pH? What's the range? 7.35, 7.45. This is 7.30. I know that's low. Okay, I don't need the system to highlight it in blue and put an L next to it for low. What's a normal arterial CO2? 35 to 45, and holy crap, this patient's is 123. Okay? If this was my example, I would put 3 H's here for that is really, really high. Some systems have arrows. Some systems have arrows. That's, yeah, exceptionally high. This blood gas in particular was texted to me by a former student of mine that wanted me to see the CO2. because it's ridiculously high. And we'll look at these and interpret some of these numbers a little bit later once we get through all our discussions, the several parts. We'll actually come back and look at this one. But there's other things that are there. There's some things that are not highlighted. That's the arterial PO2, which again, what's the normal? 80 to 100, this patient's was 84. And so that's acceptable. Their O2 sat was 94.3% measured on the blood gas. That's pretty normal, that's acceptable. You can see the hemoglobin, you can see the carboxyhemoglobin, you can see the met hemoglobin level. And this patient's on some sort of device. What do you think that is? Non-rebreather mask. Non-rebreather mask, that NRM. I abbreviate it NRB myself personally for non-rebreather, but this place abbreviates it NRM. Okay, so that will come from the blood gas, the information, the numbers that are being measured, plus what the patient's on. Sometimes it doesn't show it here, but sometimes you may even see the FiO2 that the patient was on. Something to be able to compare to what the results are. All right, let's start with the easiest part first, and then we'll get to some of the other stuff. All right, the easiest part first is let's interpret the PO2. The arterial PO2. Again, what's the range? 80 to 100 is normal, so it's on the screen. If it's less than 80, just keep it simple, less than 80, what do we call that? Hypoxemia, period. If it's less than 80, that's hypoxemia. Okay? Low levels of oxygen in the bloodstream. If it's less than normal, if 80 is the lower limit of normal, if it's less than 80, then that's hypoxemia. But we could break it down even further into mild, moderate, or severe, depending on what the level is. If it's, again, less than 80, so somewhere between 60 and 79, we consider that mild hypoxemia. If it's less than 60, somewhere between 40 and 59, moderate hypoxemia. Anything under 40, we would classify as severe. Okay? This is my 2 cents for what it's worth when it comes to, because again, what we're talking about, beginning to talk about today, there's lots of numbers that we're going to have to memorize, right? Numbers we're going to have to come back to. I could ask questions, you know, patient has a PO2 of such and such. Is that mild, moderate, severe, or is it normal? The ranges are fine. The ranges are what they are, but myself personally, I focus on this level. If 80 to 100 is normal, that's fine. I'll remember that. If it's less than 80, mild, less than 60, moderate, less than 40, severe. And I think that way, instead of trying to memorize this 60 to 79 and 40 to 59, to me that gets a little cumbersome. It's, again, less than 80, mild, less than 60, moderate, less than 40, severe.
Chunks of 20.
What's that?
Chunks of 20.
Yes, and I think that's easy, at least for me, and personally, it's easier for me to remember that. And again, when I can give you guys helpful hints to help memorize some of these things or remember some of these things, I always try to do that. So, next slide here. For this one, if we simply said the patient's P(a)O2, arterial O2 is 59, how would you classify that? I know it's hypoxemia, but what level, what degree?
Moderate.
Moderate. Okay, it's under 60. Moderate. What if it's 34? Severe. Again, less than 40. Severe. What about 74? Mild. That's just a little under 80. All right, mild. What if it's 83? That's normal. No hypoxemia. Okay, so I can ask you a million questions from just what we're talking about today and into the coming weeks or coming days. It could be simply, that's all I give you in the question. Patient has a PO2 of 34. How would you classify it? Mild, moderate, severe, normal. All right. And again, I can make the number different on the test, make it 38 on the test. It's still less than 40. All right, so looking at the pH. Again, what's normal pH? 7.35 to 7.45. That's the normal range. If you said, well, I want to know exactly what a normal pH is, then I'm going to say at 7.40, right? Perfectly smack dab in the middle of that range. But we do have a range, and we still classify everything within that range as being normal, 7.35 to 7.45. If the pH falls less than normal, So now we're saying it's falling below 740, below the low range of 735. So something less than 7.35, we would classify that as an acid or an acidosis. So when we look at the blood gas and we look at the pH, classify what the pH is. Is it normal, meaning it's between 735, 745? If it's less than 735, we call that acidosis. If it's higher than 7.45, we call that alkalosis. Okay, so the pH is going to be one of three things: normal, acidotic, or alkalotic. It can only be one of three things. All right. On the next slide, let's do the same thing we do to PO2. What if the pH is 7.32? What would you call that? Again, remember, answer options are normal, acidosis, or alkalosis. So patient pH 732, acidosis. What if it's 754? Alkalosis. What if it's 743? Normal. What if it's 720? Acidosis. You're interpreting what appears on an arterial blood gas. What makes it challenging is when you start to add all these other numbers and having to look at the big picture. But right now, individually, you could look at pH and tell me, is it normal, is it acidosis, is it alkalosis? True? Yes? Okay. Looking at the CO2. Now the CO2 is classified as the respiratory component of the arterial blood gas, the CO2. And we should know that already. Isn't it the CO2 that I can change minute by minute, second by second, basically, and alter ventilation? The respiratory component, that is CO2. CO2, normally 735 to 745. All right, there's your normal, 735. 35 to 45 for CO2, sorry. When I say it too slowly, then everything gets all jumbled. All right, so normal CO2, 35 to 45. That's the normal range for CO2, with an absolute normal number of 40, right, smack dab in the middle, but there, of course, is the range, 35 to 45. I'm doing it again. CO2 is an acid. CO2 is an acid. If you have an excess amount of CO2, means you have more acid. Guess what that causes your pH to become? More acidotic. So the CO2 will alter your blood pH. If you have too much CO2, what will happen to your blood pH? It will begin to fall, becoming more acidotic. The exact opposite is true. If you lose CO2, you eliminate CO2. If I suddenly breathe faster right now and start exhaling, removing all my CO2 levels are going to fall. That will affect my pH and cause my pH to go up, creating an alkalosis. So CO2 being the respiratory component of the arterial blood gas.
Just to repeat what you
Yep.
just said, you said too much CO2, your pH falls, and then like becoming more like acidosis.
More acidosis.
Are you saying too much O2 or too little CO2?
I said CO2, not O2.
Okay, too little CO2 is
Too little
gonna make
CO2
it alkalosis.
is going to make, too little CO2 is going to make the pH go up, creating an alkalosis. So let's look at this. What if the CO2 is 54? Would that make, or excuse me, 52? If the CO2 is 52, would that make your pH more acidotic or more alkalotic? That, again, CO2 is an acid. If you have more of it, it's going to make your pH go acidotic. In which direction will your pH go? Down. It will go down. What if your CO2 is 37? What would that make your pH? Normal. I think the hardest part sometimes when we get really into blood gases is you end up misinterpreting the normals because you want to find something wrong that's not there. 37 is normal. What if the CO2 is 24? That's less than normal, right? That would cause your pH to become more alkalotic or more alkalosis and cause your pH to go up. Last one, CO2 is 47. That's close to normal, but it is a little bit, a couple ticks above normal. That would cause what to happen to your pH? It would cause your pH to fall, causing an acidosis. All right, so remember, CO2 will affect your pH, will make your pH move up and down. This, yes, go ahead.
The first one was acidosis?
This one would cause an acidosis, yes. If the numbers are higher than normal, it would cause an acidosis. If the numbers are lower than normal, it would cause an alkalosis. The relationship between CO2 and pH is inverse. If CO2 goes down, pH goes up. If CO2 goes up, pH goes down. They have an inverse relationship with each other. And again, the CO2 represents what component of arterial blood gas? The respiratory component.
So 47 milligrams of mercury is what now?
That's higher than normal, right?
Yeah.
Not by much, but it's still higher than
Higher.
normal. That would cause an acidosis. It would cause your pH to fall.
Okay, okay. Gotcha. Maybe. I'm just saying that's higher though, so.
Yes, CO2 is like an acid, right?
Okay,
If
okay.
you have
Yeah, I got it. All right.
an excess of it, it's going to make the pH fall. It's going to make the blood more acidotic.
That's the one concerning.
And we'll get to
Are you?
when we're concerned in time.
Are you expecting like inverse reactions?
What do you mean?
Like I guess it's like your CO2 and your pH like very related to each other where
Mhm.
like, I mean, you're gonna see, I guess like you won't see a normal pH if your CO2 is like, elevated.
We're not there yet. We're not there yet. We're not there yet.
It's not like, you know, like the gas laws where it's like things are inversely like, you know, whatever. It's not like a law, it's just like
I mean, it's cause and effect.
Yeah.
Cause and effect. If you wanted to see my pH right now become more acidotic, hold my breath, I'm not gonna breathe. I'm building up CO2, my blood pH is gonna fall. You wanna see my blood pH become more alkalotic? I'm gonna hyperventilate, I'm gonna eliminate all my CO2. And I can easily alter my blood pH just based on my what? Breathing, my respiratory system. All right, and I guess I should have opened with this. There's only two systems. The respiratory system, which is CO2, and the metabolic system, which is the bicarbonate. Okay, those are the two things that can influence my blood pH. My respiratory system, the CO2, or the metabolic system, my bicarbonate. And again, when we were talking about, make sure you remember the normals for pH, CO2, and bicarb. This is because the bicarbonate is part of the metabolic system. All right.
So, would all these normals still be the same for like a baby, like for a NICU? So,
Yes and no. Brand new newborns, their numbers are going to be a little bit different. They're going to be close to ours, but they're going to be a little bit different. But generally, probably after a couple of days post-delivery, then their normals and our normals are pretty much the same. Pretty much the same. But the numbers are going to be a little bit different when they're brand new. When they're brand new newborn. All right, so bicarb is the metabolic component of the system. Okay, what's a normal bicarb? 22 to 26. And make sure I put it right here. Milliequivalents per liter. Milliequivalents per liter. All right. Where I said CO2 is an acid, bicarb is a base. There's your buffer. If you have an excess of bicarb, an increased amount of bicarb, that's going to make your pH go up and become more alkalotic. If you have a deficiency of bicarb, you don't have as much base or buffer anymore, that's going to make your pH fall and become acidotic. Whereas CO2 and pH have an inverse relationship with each other, bicarb and pH have a direct relationship with each other. Bicarb goes up, pH goes up. Bicarb goes down, pH goes down. And that's probably one of the most confusing parts when we get to the interpretation. It's because one system causes the pH to act one way, whereas the other system causes the pH to act a little bit differently as far as going up or going down.
Wait, so CO2 has a inverse relation
With pH,
and bicarb with pH has a direct
direct relationship. All right, so again, if the bicarb is less than normal, it's going to make the pH go down, become more acidotic. If the bicarb level goes higher than normal, that's going to make pH go up and be more alkalonic. So looking at the next slide, remember, bicarb is a base, bicarb is a buffer. If it's in excess, it's going to make your pH more what? Acidotic or alkalotic? Alkalotic. It's going to make the pH go up. Here the bicarb is 19. It's less than normal. How's that going to make the pH? More acidotic, or make the pH go down. What if it's 42? That's higher than normal. That's going to make the pH go up, become more alkalotic. What if it's 25? That's normal. pH is not going to be altered or changed because it's in the normal range. Did I tell you this was the easy part? Part one?
Yeah, like 10 times.
I'm kidding. I'm kidding. Once we get rolling with it, you'll feel more comfortable with it. Right now, it's just kind of laying a few foundational bricks that we have to eventually put in order. All right, so when we get to the point to interpret, all right, so now we're going to talk about interpreting the big picture. When we incorporate all those variables together, look at the pH. Tell me, is it acidotic or alkalotic? Look at the CO2. Tell me if it would cause an acidosis or alkalosis. And the same thing with the bicarb. Would it cause an acidosis or alkalosis? And then I'm going to look at all three and put that relationship together. Is it the CO2 that's causing the pH to be where it is? Is it the bicarb that's causing the pH where it is? Or maybe it's even both systems causing the pH to act a certain way. If you find out, if your answer to this question is, well, it's the CO2, that's what caused the pH to go that direction, then we say that's a respiratory problem. It's a respiratory acidosis or alkalosis. If it's not the CO2, it's instead the bicarb, then we call that a metabolic issue, a metabolic acidosis or alkalosis. It'll make sense when we start putting the numbers up here and kind of slowly working our way through. So for example, this is our blood gas. Don't blurt it out. Please don't blurt it out. Let everybody have a chance to take a look at it. When we look at this blood gas, the pH is 726, okay? CO2 is 51, the bicarb is 24. Now ask yourself this question. First off, is that normal? No.
No.
Higher, lower than normal? Okay. So lower than normal? CO2 is 51. Is that higher or lower than normal? Higher than normal. What about the bicarb? That's normal. So I'm not giving it an arrow up or down. So looking back at the pH. So we say the pH is low, which would cause a what? Acidosis. What's causing the acidosis? Is it the respiratory system?
Yes.
Or is it the metabolic system?
No.
Or is it both systems? Right now it's just the respiratory system. So what would we call this? Respiratory acidosis. Respiratory acidosis. Plain and simple. Okay? Looking back at the pH. What's causing this pH to be abnormal? And again, I got two systems here. Is it the respiratory system or is it the metabolic system? Right now it's the respiratory system. So this would be classified as a respiratory acidosis. Let's look at another one. This one, the pH is 7.48, the CO2 is 42, the bicarb is 30. Starting with the pH at 7.48, what would you call that? Alkalosis, so it's up, right? It's elevated. The CO2 is 42, that's normal, so that's where it is. The bicarb is 30, that's high, which would cause a alkalosis. So again, ask yourself the question, what's causing the pH to be what it is? In this case, alkali. It's the bicarb. So that's classified as a metabolic alkalosis. Metabolic alkalosis. Maybe not as difficult or as originally thought. Again, we've only got 2 here. So I start with these first couple using these arrows, and let me be honest, I hate using arrows to interpret. Because if I use arrows to interpret, then the next step is I have to interpret arrows. So I just gave you the first couple just as an example, so we can at least look at these and go, okay, that one's high, that one's low, that one's normal. When I look at a blood gas to interpret, I skip this step as far as saying that's elevated or that's increased. I look at and I ask the question, is that an acidosis, alkalosis, or is that normal? So what would you say with this?
Alkalosis.
Alkalosis. So I write alkalosis next to it, or ALK, just so I know, oh, that's an alkalosis. When I look at the CO2 and I see that's normal, I write normal. When I look at the bicarb and see it's elevated, I ask the question, well, what would that cause? Alkalosis, and so I write alkalosis. And so when I interpret, I know this is the metabolic system and I know this is the respiratory system, I ask the question, which system, now I don't even need to look at numbers, which system caused the alkalosis? Respiratory or metabolic? And I say, clearly it's the metabolic system. This is a metabolic alkalosis. Jim?
Theoretically, if the CO2 was low enough but the bicarb was still normal, would that still cause an alkalosis?
Say that again, if the
If the CO2 was so low but the bicarb was normal, would it?
low but not, meaning not normal.
Right.
Okay,
Would-
we're not there yet. We're not gonna get there yet, so I'll hold off on that one. Because yes, the other system is always not necessarily gonna be normal. But today it is. For today's lesson, that other system's gonna be normal.
Fine.
For today. Connor?
Does the body have other ways of producing bicarb besides metabolizing CO2, like
The kidneys.
through
The kidneys. The kidneys will release bicarbonate into the system to try to, or to compensate. And again, I'm not using the word compensate because that's next week's talk. That's next week's word. But problems related maybe to the kidneys or lack thereof could cause some of these situations to occur where there's elevations in bicarbonate that then in turn could affect pH.
You use the wrong thing, like, to remember. You used to remember, like, with the acronym ROM, R is for respiratory, O is for opposite. So respiratory is opposite, like if, pH goes up and then the other goes down. And M is for metabolic, and E is for equal. So metabolic go the same direction, and
To
the
be fair-
respiratory.
To be fair, there's all kinds of different ways to interpret blood gases. There's all kinds of different mnemonics, acronyms, things that could be used. I don't want to say formulas because there's not really a formula per se. There's so many different things out there that if you go after today and start to researching some of these things, you could easily get confused because there's so many different types. I try to take I don't want to call them shortcuts, but those other methods away and just say, visually, look at the blood gas and interpret from what you're seeing. Some of the others initially, maybe in the beginning, may help you kind of get that a little more concrete. But when it's all said and done, you should be able to look at the blood gas and without hesitation, see what the problem is. Because once we identify the problem, then the next step later, which we'll get to, then let's fix it. Let's do what we need to do to fix this problem in the first place. All right, so let's do some interpretations here. And again, I'm doing these super slow. We'll do these together. And I don't remember, I'll pull these up to see. I just want to see something for a second. Bear with me. You could look at the numbers. So pH is 724. CO2 is 57. Bicarb is 24. Quite long enough, isn't it? Maybe. All right, so if I'm gonna look at this, so pH is 7.24, CO2 is 57, bicarb is 24. Instead of using those darn arrows, I'm gonna just write next to it. So pH is 7.24 means what? Acidosis. All right, CO2 is 57. It's gonna be a long day. CO2 is 57. What would that cause? CO2 is an acid. CO2 is an acid. You have an excess of it. That's gonna be an acidosis. What's
I
that?
have a better expo, do you want it?
Oh, I got some.
Do you have
Several.
others?
I got another one. Oh, that works.
Man, somebody love this guy.
All right, bicarb, thank you. Bicarb is 24. That's normal. So when I look at this and I see the pH is saying acid, which system is causing an acidosis? It's the respiratory, it's the CO2. So this interpretation would be what? A respiratory acidosis. Respiratory acidosis, plain and simple. And I don't remember if I had, yep, there it is. I did have that on there. That's handy.
Why don't you use that spray guard?
There's like 87 blood gases today. Holy cow. All right.
What?
Yeah, like, what?
Maybe 86, 85, 86.
I'm just thinking, we pay all this money for school and they can't give you no markers?
That's what I'm saying. I actually got this out of a brand new box, but I guess the box is probably old.
Sometimes you gotta break it in.
There you go. I'll keep working at it. All right, everybody okay? Yes.
Sorry.
No, you're good.
Can you go back to the first example, because I think I messed up and it's confusing me with the
This
others.
one?
No, the 7.26 and the 51 and 24, yeah.
Okay.
The middle one, is it acidosis or alkalosis? Okay, okay,
Right.
that's what I messed up. Yeah.
Right.
Okay.
Okay. No, make sure you get it. Make sure you get it.
So CO2 will always be acidosis then?
CO2 is an acid.
Okay.
Bicarb is a base. If you have too much of an acid, your blood's going to be acidotic. If you have too little of an acid, your blood's going to be alkalotic. The bicarb, you have an excess of the base or buffer, your pH is going to be alkalotic. You have deficiency of that bicarb, blood pH is going to be acidotic. Let's get through those. That was the last one we did, respiratory acidosis. All right, here pH is 7.49. Now that's higher than normal, yes. But what would that cause your blood to be? Alkalotic. CO2 is 24. That's less than normal. That would cause an alkalosis. Your bicarb is 26. That's normal. So when I interpret this, pH is alkalotic, but which system is causing it? Respiratory system. So here's your respiratory alkalosis. My lab group knows how particular I am. I can't have things out of place. Sorry. All right, everybody okay with this? Respiratory alkalosis. Here the pH is 7.29, the CO2 is 45, the bicarb is 16. pH is low, so that's causing an acid. CO2 is 45, that's normal. Bicarb is 16, less than normal. That would cause an acid. And so what's causing this pH to be acidotic? The respiratory system or the metabolic system? Metabolic system. So here's your metabolic acidosis. Questions? Okay. Here the pH is 7.44, the CO2 is 43, the bicarb is 22. A pH of 744 means normal. A CO2 of 43 means normal, and a bicarb of 22 means normal plus normal plus normal must equal normal. So this is a normal ABG. And be careful on this, because I know on a test, you're going to be so focused on interpreting and finding the bad stuff that when I throw in a normal, and I'm being honest, that's the one that people get wrong. Because you end up trying to put something there that's not really there. Okay, so just be careful. Normal blood gases do still exist, right? We're gonna draw that blood gas from a patient, we're gonna check the numbers and go, all right, blood gas wise, everything's okay, everything's fine.
With that, number, would you consider?
It's okay. All right, and notice some of these are really close to the borderline of being abnormal, but right now, are they? They're not yet.
I was about to say, so because two of those are very close, would you check back later?
They're normal or not normal, and right now they're normal. Now, of course, to answer that question, yes, we could always look back if they're, it's kind of border, but it's still technically normal.
If they have a change in,
Consult physician.
Sure,
Would you
sure.
like, would you wanna like check it again if they had like a change in like the oxygen that they were getting, or like the type?
Of course. If something is changing appearance-wise, signs and symptoms about the patient that indicate the blood gas could have changed, then of course we could always get another one. But remember, we're not even looking at the O2 here, right? The O2 would be another part of this blood gas, but the O2 part has nothing to do with acid base. And so it's why I kind of purposely left off the O2 right now. We'll eventually see it and it'll pop up, and that just gives us something else to have to think about or analyze, but it has no effect on blood pH. It's the bicarb or it's the CO2 that can alter the blood pH. All right, let's do a few more. Here the pH is 756, so that's higher than normal. That would cause a what? Alkalosis. The CO2 is 35. That's normal. The bicarb is 49. That's high, which would cause an alkalosis. So which system is causing the pH to be alkalotic? The metabolic. So your interpretation, metabolic alkalosis. That's what I said. When you go back and you start interpreting, I really need to have this written down somewhere so I know what my normals are and then what they mean if something's too high or something's too low. So I always got to start with the normals, right? I always have to start with the normals. And I'll leave that there. All right, so metabolic alkalosis, we're okay with that one? All right, here the pH is 751. I'm losing it. All right, 751.
Oh.
You didn't see that. Alkalosis. CO2 is 15. Alkalosis. Bicarb is 26. Normal. So which system's causing the alkalotic pH? Respiratory system. So here's your respiratory alkalosis.
There's probably going to be something you're going to go over later on.
Probably.
But,
Go ahead.
But, so if the CO2, for example, is low and creates an alkalosis, but the bicarb is also high, also creates an alkalosis, is that going to be like a alkalosis?
We're getting to that in just a second.
Okay.
I didn't print slides out, so I don't remember when it's coming, but we have one that's coming just like that. So hold that question for just a second.
Okay.
All right, everybody okay with this one in particular? Watch it be the next one. It is. All right. Oh, there you go. Good. Good thing
I
you
have a
asked.
question.
Yes, before we get to this one.
So for the carbon, the CO2,
Yes.
I know that you said that if it was too high, then it would be acidosis, but if it's too low, then it's alkalosis.
Mm-hmm.
The pH is the opposite?
Yes.
Okay, that's where I'm messing up.
Yes.
Alright.
Bicarb and pH go together. CO2 and pH,
Inverse.
inverse, inverse. So if I'm gonna, I guess that'll be all right for now. If I'm looking at this normal, and what I'm gonna write out to the side means if it's higher than this, that would cause an alkalosis. If it's lower than this, yep, lower than this, that would cause an acidosis. CO2, if it's higher than this, acidosis. If it's lower than this, alkalosis. Bicarb, higher than this, alkalosis. Less than this, acidosis. Maybe there's your shortcut on the test. In addition to the normals, how it's going to impact blood pH. Okay? But, and I wish that they all would be lined up to say acid, 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 or alkalosis, alkalosis, alkalosis. But it's the CO2 being opposite that kind of flip-flops the sequencing here. That help?
Yeah.
Okay.
Thank you.
So we could use this when we're doing this. So pH is 726. What are we going to call that? An acidosis. The CO2 is 53. Acidosis. And the bicarb is 19. So you have a pH that's acidotic, and you have the respiratory system saying acid. You have the metabolic system saying acid. In this case, both systems are contributing to the acidosis. So what do we call this? You could say it's a respiratory and metabolic acidosis, or simply you could say combined, or some people will say it's a mixed acidosis, meaning both systems are causing the problem. Because if you just said respiratory acidosis, you're half right, but you're not giving justice to the metabolic system that's also contributing to the acidosis. So it's possible. You can see something like this. It could be the exact opposite. It could be combined or mixed alkalosis. Again, both systems contributing to the problem with the pH, related to the pH. Okay with this one? The mixed or combined acidosis. I know most all my tests are multiple choice, so the answer is going to be there. But just as a reminder, because this has happened over the years when I would give a short answer test, maybe it's a homework assignment somewhere down the road, and I ask someone to interpret, let's just say, this blood gas. Please remember, if you say it's combined or mixed, that's fine, that's right, but you have to tell me, is it an acidosis or alkalosis? I've had some students before just say combined. All right, but I need more. I need to know, is it combined acidosis or combined alkalosis to be correct? You just can't say combined and leave it at that. It's combined acidosis or alkalosis. And you can't say combined normal or mixed normal. No, that doesn't exist. All right, everybody okay with this one? This is probably the easiest one because both systems are causing the problem. There's no, is one normal, is one not normal? No, in this case, both systems are causing the problem. So a mixed or combined, in this case, acidosis. I got this, pH 733.
Acid.
Not by much, but technically it's still an acid. CO2 is 48.
Acid.
Normal? Acid?
Acid.
Alkalosis? Acid. Bicarb's 25? Normal. So this is a what? Respiratory acidosis. Respiratory acidosis. Again, numbers are not that far off, but at some point there has to be a line in the sand. It's either normal, or it's acid, or it's alkalosis. In this case, not by much, but it's still technically an acidosis. So this one's a respiratory acidosis. All right. We all right with those? 740, we call that normal. Can't get any more normal than 740. CO2 is 41. Normal bicarb's 22. So that must mean their blood gas is normal. Right, normal plus normal plus normal will equal normal.
Normalize it.
Everybody okay with that? And yes, I am throwing in the occasional normals just to see if you're paying attention. All right, what about this one? pH is 750. Alkalosis. CO2 is 47. That's high. Acidosis. Bicarb is 14. That's low. Acid? Acidosis? Okay, so that one's easy. What do you have? Combined what?
Combined mixed.
Combined mixed, combined.
Alkalosis and acidosis.
It's based on
Inverse.
pH, so would it be alkalosis?
I think that meme, huh?
Inverse alkalosis?
Reverse alkalosis?
Inverse.
Oh,
Because we're inverse from the, I don't know. I'm just
What do we
making-
have here?
just making up stuff.
Yeah, doing a good job with it too. What do we have here? This is what our blood gas analyzer is telling us. Again, who draws the blood gas? The respiratory therapist. Who analyzes the blood gas? We do. When we release these results, we're saying based on our license and credentials, this is the information. This is the patient's blood gas. But you know what we have in front of us?
Is it Venus?
Very good. We have an error. Who's that error? Yeah, very good. We have an error. Is it possible? Yes. We're trusting that blood gas analyzer to give us correct results, right? And if I notice those results are not humanly possible, I cannot accept those results and say, yep, here you go, doc. Here's the results. I can't go, well, that's what the computer said. It must be the computer. No, I'm putting my own credentials and license on the line when I release something like this. Do you think a computer, do you think the analyzers go bad from time to time? Not an everyday occurrence, obviously, but they can. But it's up to us to catch it when they do, to say, you know, these numbers make absolutely no sense. It is not possible for our two systems to say acid and a pH not to read acid. If these things are going to be causing an acidosis, that pH better be acidotic. It can't even be normal. If it is, that's still an error. Acid plus acid better be an acidotic pH. Couldn't happen. Okay, so this example is an error. Now, I promise I'm not going to give you too many on the test. Too many on the test. I had one student one time after the test, and I don't remember how many blood gases I'm going to give you to interpret, but it's going to be a fair amount, let's be honest. I had a student tell me after the test, man, you threw a lot of errors in there, and I'm thinking, no, I didn't. No, I didn't. 1, 2 tops? No, I didn't. I'm thinking, oh no, they probably got things backwards, and that's why they kept seeing error, because they were saying alkalosis or acidosis. You know, they got the interpretation flip-flopped. You know, based on their interpretation, yeah, it was an error, it wasn't possible, but they got the things kind of backwards. But I just wanted to share with you, seeing errors or having errors on occasion are possible, And in this case, I would not accept the result. I wouldn't release the result into the patient's chart because it's not real. I would take whatever I have left of that patient's arterial blood and go find another machine and run it through another machine's analyzer. I wouldn't trust the machine I'm standing in front of. I go, you know, I don't believe this. Let me go try it on this machine. And in most blood gas labs, there's usually more than one ABG analyzer in case one goes bad or one goes down. And if I left the lab, I would write a note, because again, I'm trying to get this patient's blood gas results so we can take a look at them. I would put a big sign on there, out of order, you know, call the supervisor and say, hey, somebody needs to run this through some controls, some quality controls, quality assurance to make sure it's working right, because it didn't work right for me with the last blood gas that I just ran it through.
To assure quality assurance and training, your plans may be reported.
All right, any questions on this one?
So it's not possible for our two systems, respiratory and metabolic, to show acidosis, or vice versa, and our pH to show the opposite?
Right, it's possible for one to cause the problem, it is possible for the other system to cause the problem, and it is possible for both systems to cause the same problem, but the pH better read, in this example, acidosis. Remember, it obviously can't read the opposite, alkalosis, and it couldn't read normal either. You have both systems, and it's only these two systems that are causing the pH to behave or act the way it is. If you have both systems saying acid, you couldn't even have a normal pH. Would not be possible. Now, if I'm looking at this saying, and let's just hypothetically say, this was actually correct, this was actually correct, the pH would have to be acidotic. It couldn't be anything other than acidotic.
The others can be wrong too, or.
And they can, of course they could,
Yeah.
of course they could, of course they could. But regardless, all three together, not possible. That's why I say this is an error. This is an error. All right, let's look at some others. Okay, now I gave you these because these are actual patients' ABG results. And so I didn't filter out stuff. I wanted to let you kind of look where there's multiple things, multiple numbers to look at. Easily can become overwhelming because there's so much information in front of you. But let's focus on what we've discussed so far. So when I look at this one, thank goodness the board's just tall enough. The pH is 740, normal. The CO2 is 41, normal. The bicarb, 25.4, normal. Okay, and you can even see the PO2, 83, normal. A few other things just to point out. There's your hemoglobin. There's the O2HB. There's your oxyhemoglobin. There's your carboxyhemoglobin. There's your methemoglobin. This is a calculated saturation. This, however, is the true saturation, 95.4. Again, because it's telling you the oxygen on the hemoglobin, 95.4% saturated. All right, some other things are there. We'll get to some of those other things in due time. And I know you can't see it on the board, but down here, their FiO2, just in case you're curious, is 60% that they're on. So even though the numbers look pretty decent, what we're looking at here, this patient required 60% oxygen, not 21, 60% oxygen to be normal, to get that to 83. If I had you on 60% oxygen, your number would be a whole lot higher. All right, so just to put it in relative terms here. All right, so interpretation of this blood gas, however, I would say normal. All right, what about this one? pH 720, acidosis. CO2 is 62, acidosis. Bicarb 24.6, normal. What would you interpret this to be? Here's a respiratory acidosis. Respiratory acidosis. Everybody all right with that one? Next one, patient has a pH of 743, normal, CO2 of 43, and a bicarb that's 22.5. So you interpret this one to be, okay?
In this chapter, are we gonna learn what would you do to correct
Not yet, not yet, not yet, not yet. That's coming in time. We gotta first interpret first. All right, so how would you interpret this blood gas? You're taking the results back to the doctor and you're telling the doctor the patient's ABG is?
Well, the oxygen.
Well, there's no wells. It's either yes or no. All right. If you said normal, the physician's going to say you're no longer allowed to work in this ICU. Because notice what you're calling normal. You're calling a patient with a saturation of 82% and a PO2 of 45. What's normal?
The pH.
What's normal? 80 to 100. Their PO2 is 45. What's their saturation? 82%. And you're calling that normal? And of course, I'm setting you up to make a mistake here, right? We've been so focused on acid-base interpretation that I give you one whose acid-base interpretation is normal. I haven't been having you focus too much on the PO2 since the very first couple of slides, but be careful what you call normal. Because this one clearly, this poor patient definitely does not have normal oxygenation, even though acid-base, respiratory system, metabolic system, is okay at the moment.
And that's with an FiO2 of 80%.
Yeah, and their FiO2 is 80% to get their PO2 to 45. You know, you could say, well, do they need 100? Well, they need something more than what they're getting because this, how low this is and how low this is.
Like 200 or something.
So be careful, and my intention here is just be careful what you call normal. I know there are certain parts of this that are normal, and I get it, and I set you up to make the mistake here, but be careful because they're definitely, you may say normal acid base, but you would say this,
Everything else.
based on our number here, you would say this is a moderate hypoxemia. Once we lose 5 more or less, then we're talking about severe hypoxemia. So yes, definitely an oxygenation problem here, but acid base is normal. And so what we're saying is normal is really the acid base.
But that can be something that, like, over time, with that number of O2 and everything, will change the pH, right?
It will.
The carbon dioxide will increase or
So
something.
over time, and that's very good, and who knows exactly the time we drew this, but if we didn't fix this over time, the patient's gonna be in a world of hurt and a world of trouble. So, and I'm not sure when this blood gas was done. This patient could have been in the middle of their hyperventilating because their O2 is so low. And normally if you hyperventilate, your CO2 levels would be what? Very, very low. But maybe the patient's now tiring. And so the CO2 is starting to climb and build back up. And right now we happen to catch it when we did the blood gas and it was 43. But it's going to continue to climb. And it's going to continue to pull my pH down. Which eventually, maybe 30 minutes from now, we do the same patient's blood gas. Their CO2 is here, their pH is low, they're not ventilating, their CO2 is sky high. You know, so it just happened to be when this blood gas was drawn. But clearly, they're having an oxygenation problem. But right now, acid-base balance is acceptable, is normal.
So if you go back to that last one with the respiratory acidosis, yeah, that one. So that one you would say that they have a mild hypoxemia as well?
Correct.
Okay.
Correct. Yep. Because the PO2 is 70. So mild hypoxemia. Now I'm going to get you not only focusing on acid-base balance, which is the harder part of all this, but you can't forget about the O2 part. So let's go on. So there's that one. Let's look at this one. pH 6.91. Acid. CO2 is 111. Acid. Bicarb, where's bicarb? 22.2? Normal. Let's go ahead since we started it. Oxygenation? Normal. All right, so how would you interpret this blood gas? Respiratory acidosis, big time, right? When this is normally supposed to be 35 to 45 to maintain a pH of 735, 745. This patient's CO2 is 111. And what happens to their pH? It's significantly falling. This acid-base balance here, that blood pH, is really not compatible with life. It is that low, that low. Oxygenation-wise, we call it normal. Their saturation, if I round it up, we call that 91. That's borderline. We'll be happy. We're happy it's in the 90s. My biggest issue is look how low that pH is. Does that catch your attention? That's the total hemoglobin's not even 8. That's about half of normal, right? So that's another issue still related to oxygenation. So their 7.9 hemoglobins are 91% saturated. And 91% saturation already is on the lower end of what we would consider even acceptable, but they don't have a whole lot of buses or a lot of Ubers to deliver that oxygen. Huh.
Can anemia cause respiratory acidosis?
Not initially, no. But it can affect someone's ability to oxygenate, which, again, if that happens, it then in turn could affect the patient's ability to ventilate. So we'll eventually come around to it, but as far as anemia and respiratory acidosis or alkalosis, not necessarily directly related, but kind of, you can go around the loop and get to that problem. All right, any questions on this one? Yeah. You see a pH in the 6s, let me know. Let me know. And maybe follow up and see how that patient's final outcome was. Because that's exceptionally low. Exceptionally low. We get worried when the pH falls less than 7.2, just so you know. And again, that's still abnormal, but 7.2, that's red flags, that's danger type things. When it starts with a 6, that's really horrible.
What's the wonkiest blood gas you ever seen? Like
With
personally.
pH, it's similar to this one. Similar to this one. You know, 6s, 6.8s, 6.9s. Yeah. Again, not really compatible with life. All right, next one. pH 705. I'll leave my stuff up there. 705, that would cause a acidosis. CO2 is 63. That would cause an acidosis. And the bicarb is 17.7. Acidosis, right? So both systems, respiratory and metabolic, causing the acidosis. So here's your combined or mixed what? Acidosis. So don't forget that last part. Mixed or combined acidosis. Oxygenation. PO2 170. And of course, this is the one that I've not given an FiO2 with, but I would make the assumption the patient must be on some sort of supplemental oxygen to get the PO2 that high. Saturation's good. Hemoglobin, again, about half of normal, right? So that's definitely low. But as far as acid base goes, yes, this is a mixed or combined acidosis. Questions? No? I forget how many more of these I have. This is the last one? Uh-oh, kind of cut me off there. All right, pH is 7.48. 7.48, that would cause, all right, I'm just gonna write it here. Alkalosis, 7.48, it's a little above normal. The CO2 is 38. That's normal. Where's bicarb? Bicarb is 29.1. Alkalosis. And so if I have to interpret acid-base wise, what's causing the pH to be alkalotic? The metabolic system. We could look and say, okay, the PO2 is 184. Patient was on 60%. That makes sense. All right, so be careful when you interpret a blood gas, especially at the bedside. And trust me, the clinical instructors, the folks you guys see on Tuesdays, have asked, when are you talking about blood gases? To me. I said, we're just starting it this week. So don't be surprised when you're in clinicals if suddenly you start getting blood gases thrown at you to interpret. And it's not going to be the shorter version like I opened with, pH, CO2, bicarb. It's going to look like something like this. Lots of data, lots of numbers, but it's okay. Give me all the data because I'm going to filter, in my mind, I'm going to filter through. pH, CO2, bicarb. Those things are all together so I can interpret. And yes, I will glance over at the O2 and the saturation to be able to speak oxygenation-wise. But acid-base balance, that's the most challenging part. That's the toughest part that we're looking at here. All right. Feeling better about yourself, worse about yourself? It's neutral right now. So, of course, I can't do a lecture or lesson with lecture or lesson without giving you some questions at the end. Okay, questions at the end. No, dang it, really? So if you want to snap a picture of these, you're more than welcome to, and I don't even remember how many I gave you, so bear with me. All right, so this is like the test, right? This is how the test is going to be set up. You'll have this to look at. So pH is 730, CO2 is 42, PO2 is 82, bicarb is 12. Is it a respiratory acidosis or alkalosis? Is it a metabolic acidosis or alkalosis? Or is it normal? What's the pH? Acidosis. Okay, so the pH is acidotic. The CO2 is 42. That's normal. The bicarb is 12. Acidosis. So what's the correct answer? Metabolic acidosis. So C. Metabolic acidosis. Based on this question, did you need to know the P little AO2?
No.
Based on the question, no. So don't let this O2 throw you off when you're asked to interpret simple acid-base balance, respiratory, metabolic, acidosis, alkalosis. Okay? But sometimes you start throwing in more things for you to be distracted by or to see. And again, I don't know how I would somehow flip this, other than sometimes people may see this and accidentally think that's CO2 or vice versa. So just be careful on that. Take your time. Don't try to rush through. Next question. Now the pH is 735. CO2 is 37. PO2 is 94. The bicarb is 23. Is this a respiratory acidosis or alkalosis, or metabolic acidosis or alkalosis, or is it? Normal. It's normal. This one is normal. I can't trip you up right now on the normal ones, with the exception of that PO2 issue we went over a minute ago. All right, so yes, this one is E. This one is normal. Next question. pH is now 752. Alkalosis. CO2 is 39. Normal. PO2 72. Bicarb is 42. So you have a pH that's saying alkalosis and a bicarb that's saying alkalosis. What would be your answer here? Metabolic alkalosis, or D for this particular question is D, metabolic alkalosis.
With mild hypoxemia.
Yeah, of course, if that was asked. So
Get out.
I'll get it. I'll throw him an elbow. So I could give you this question in particular, and instead of asking for the acid-base status like I am, I may simply classify the patient's hypoxemia. Right? And so when I say hypoxemia, now I'm focusing just on the PO2. Since it's less than 80 and not less than 60, mild. If it's less than 60, not less than 40, there's moderate. Less than 40 would be severe. I can ask that question too when it's time to test. Next question, pH is 718. So what's on the acid side? The CO2 is 64. High. Also on the acid side, bicarb is 26. Normal. So this is what? Respiratory acidosis. Respiratory acidosis. So this one is A. Respiratory acidosis. Everybody okay with that one? Okay, since you asked. All right, so next week, do we have a lab this Friday?
No.
We do not have a lab this Friday. Next week, we will continue to look at blood gases. We'll continue to practice what we saw today. You can't practice it enough until you become comfortable. We'll talk about and we'll add how each system can compensate for the other when one is causing a problem. When it comes to acid-base balance and interpretation, it's the compensation that tends to give folks the most trouble. Because what we've talked about today, you tend to, and again, everybody's a little bit different pace here, but you tend to get that and you hold that pretty solid, and then we throw in, oh, but this other system could try to help fix the pH. And so we'll talk about next week when we see things like a fully compensated respiratory acidosis or a partially compensated metabolic alkalosis. We'll talk about those. We'll add that to what we've discussed today. And then again, practice, 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 practice. All All right, again, one last time. Do we have a lab this Friday? No. What's going on this Friday?
Halloween.
Oh, that's right. Okay, so happy Halloween on Friday, and I will see you all next
That's why
week.
you had the lights like this.
I didn't.